In minor head trauma imaging, you should avoid head CT when it is not validated according to the decision rules and the patient has been triaged to low risk. So when the patient is of low risk according to the decision rules and he is a patient of minor head trauma, you should avoid head CT. Also, you should limit use of the indwelling urinary catheters or Foley catheters to critically ill patients to monitor urine output, or the patients who have urine obstruction or who are in perioperative state or end of life care. These catheters are not to be used in stable and voiding patients. These are not indicated for urine output monitoring in stable patients. They should void into measure container, and these are also not indicated for convenience. In palliative care and hospice, you should engage palliative care and hospice early when indicated in chronic disease or end-of-life care. In skin abscesses, you should avoid antibiotics and wound cultures for uncomplicated skin and soft tissue abscesses, but assume definitive IND and appropriate follow-up. In pediatric dehydration management, ORT or oral rehydration should be the first line intervention in mild to moderate dehydration. Intravenous replacement should be reserved for those who fail oral rehydration. These are the best practices in emergency medicine. Please subscribe to the channel, that will help me a lot. Signing off.